Spine issues are common. Many people experience neck or back pain, but surgery can be intimidating. In the sponsor segment this morning, we welcome to Good Morning Michigan, Dr. Gerald Schell, here to talk about outpatient neurosurgery and some treatment options. Good morning to you.
Good morning.
Thanks for joining us. So, first off, can you explain what the sacroiliac joint is and why it can cause pain?
Yeah, I think that the sacroiliac joint is one of the most common procedures we're now doing outpatient in spine. The sacroiliac problem is very, very common. It's where the tailbone meets the pelvic bone, and is probably the most misdiagnosed, severe, and common problem in middle-aged women and patients who've undergone spinal fusion surgery. It's a joint where pretty much most of the stresses from the spine meet the pelvis. It's the last joint in the spine, and it's an immobile joint, which when it degenerates starts moving and generates severe pain in the very low back area.
Yeah, so what would someone be feeling then if they have inflammation of that joint?
When a person is sitting or lying on one side, they get severe pain in the low tailbone area off to the side, right or left. It mimics a hip problem, sometimes a low back problem, as opposed to like having a hip problem where it's much worse with walking. This keeps people awake all night because they can't lay on one side or the other, or they have a hard time sitting like on car rides, or they get with miserable pain in their back. And very difficult to diagnose this, but very, very common.
So once you diagnose someone, how do you determine if they're a good candidate for fusion surgery, and how invasive is that surgery?
The surgery is minimally invasive. There's no sutures. It's about a 15-minute procedure outpatient with very limited problems with the recovery. The diagnosis is very difficult. It's a hard diagnosis to make. That's why most people don't know about it. All the testing of the lower back, the hip, the pelvic has to be done, and then we place injections into the joint to numb it, just to prove that the pain goes away. With the injections and some of the way we examine the patient, we can clearly determine if they have this particular problem.
And then quickly here, overall, what is the success rate? I'm sure you see success.
Yes, it's the procedures we have now have been available for about 20 years. I knew the doctor who invented the procedure and was on the original board. We've seen successes in the range of about 80 to 90%. The whole key is finding the proper patient and making the correct diagnosis. Once that's done, it really can turn a patient's life around. And
yes.
These are patients with chronic severe pain problems.
Well, the goal is to improve quality of life. We'll show information quickly for folks at home if they're interested and you have any questions. Thank you so much for talking to us today, Dr. Schell. We appreciate it.
Okay, thank you.